Alex Madaga's death Friday infuriated the nation. For 18 hours, he lay in an ambulance waiting for emergency treatment following a road accident. The family did not have the 200,000 shillings deposit that was allegedly demanded by Coptic Hospital before he could be admitted. Speaking on Citizen TV's Sunday Live, Health Cabinet Secretary James Macharia admitted that Madaga's death could have been prevented.
But we have established that those 18 hours were not spent at Kenyatta. It was spent with him being taken around private hospitals. Thus we've asked the Kenya Medical Board to give us within 7 days a report as what happened to this patient or victim of the accident. From the time of the accident to the time he died, within 7 days, we want that report.
CORD Principal Raila Odinga has now instructed his lawyers to sue 3 hospitals that allegedly failed to provide emergency care to Madaga because he could not raise amounts demanded by the institutions. It is alleged that the hospitals, among them Coptic Hospital and Nairobi Women's Hospital, all failed to provide the late Madaga with emergency treatment, forcing him to wait outside Kenyatta National Hospital for a bed in the ICU, by which time he only had a few hours left to live. The Constitution guarantees every Kenyan the highest attainable standard of health and the right to emergency treatment according to Section 43 of the Constitution. It is on these grounds that Odinga has resolved to sue the hospitals. However, the Health Bill 2014 that operationalizes this right is yet to be passed by Parliament, despite having been tabled in 2014.
That patient was denied medical services in a few private hospitals. Now, this bill, one of the things it is trying to introduce is to criminalize such action, so that somebody will be fined or taken to jail for 12 months if you deny any patient medical support.
Private hospitals will be required to admit people who are in serious need.
If they don't, it will be a criminal act not to do so.
Among the penalties proposed in the bill include a 1 million shillings fine or a jail term of 1 year or both for a health provider, and a fine of 3 million shillings for the hospital that fails to provide emergency treatment. It will also be mandatory for health facilities to display openly procedures for lodging complaints. They will be required to inform the complainant within a period of 3 months from the date the complaint was lodged of the action taken regarding the complaint. Should the hospital fail to resolve the complaint, the Kenya Health Professions Oversight Authority, which will also be formed under the bill, will take action. The bill is still in the public participation stage amid protests by interest groups who are opposing several of its provisions. It is now up to the chair of the Health Committee to liaise with the House Business Committee to schedule it for debate in the House. Esther Kahumbi, Monday Special.